Welcome to the program. I'm your host, Neal Howard, here on this Health Supplier segment on Health Professional Radio. Thanks for joining us today. In this Health Supplier segment, CEO of Loopback Analytics is returning as our guest today, Mr. Neal Smiley, and he's here to talk about how inconsistencies in the sharing of medical data leads to a lack of medication adherence among patients. Welcome back to the program, Neal.
Great to be here.
Now, what exactly do you mean by medication adherence?
Just the degree to which patients correctly follow the prescription instructions that have been given to them by their doctor or other healthcare provider.
So it's simply just taking it as prescribed. Is this, I guess, lack of adherence to taking medications as prescribed, is this something that has escalated in the past few years?
Well, it's been a long-time problem, so it's certainly not something new. I think what you're seeing is just as the population is getting older, that older patients typically take more complex medication regimens. And so as you have more prescriptions to take, then adherence is just more difficult. So it's becoming a bigger problem from that perspective.
Are we talking about medications for specific types of ailments, mental health medicines, or are we talking about all medicines across the board once you reach a certain criteria, like age, as you mentioned?
Well, the biggest challenge and opportunity is chronic maintenance medications. So these are folks that would have heart failure or cholesterol challenges, things like that, for which there are very effective treatments. But if they're not taken, then, of course, you don't get the benefit. And then there's also more acute treatments, and by that I mean things that are more episodic. For example, if you have an infection, you have to take your antibiotic treatment. If you don't continue that course, then obviously you're not going to get better.
What do you think contributes to a patient just simply not wanting to take their medication as prescribed? I mean, a lot of us, get on the internet and decide, hey, maybe I'll take half of this pill rather than all of it, or maybe I won't take it at all because of the way it makes me feel, and I just won't say anything about it.
Well, there used to be a term, medication compliance, and the whole word, compliance suggests that somebody is uncooperative. And I think so much of the time, folks aren't taking their medications not because they don't want to or they're trying to resist their doctor's orders. It's just that it's a challenge for them. And so things can break down all along the way. So maybe a prescription is written, but it never makes it to the pharmacy. Or it gets to the pharmacy and the patient fails to pick them up. They don't have transportation, or maybe there's economic barriers. So the first part of the process is how do you just make sure that patients get their meds on a timely basis, and then they're consistently refilled. And of course, then the next stage of that is once you get your medications, taking them correctly. And there, sometimes the breakdown is because patients get confused. They take old meds as well as that had been canceled, plus the new ones, or they're taking the wrong quantities, wrong time of day, all kinds of ways in which things can break down.
Well, aren't our physicians trained to help us? I mean, once we get to a certain age and maybe, we get forgetful, or maybe dementia or Alzheimer's is an issue, and maybe we just have one person at home to help us out. Aren't our doctors and nurses our support group at that time? And even when we're under their care at all, why do you think that, our healthcare providers, our pharmacies aren't helping a little bit more?
Well, I think that healthcare providers do take this very seriously, but anyone that has chronic conditions with a lot of different points of care going on, it's not just one doctor. They may be in and out of the hospital, they go to the emergency department, they may have a skilled nursing involved, home health agencies. So all of these different players, along with the patient's own family caregivers, represent a diverse set of folks to coordinate across.
Well, aren't there already standardized procedures as far as data sharing is concerned, patient to patient and facility to facility?
So this is an area where there's tremendous opportunity for improvement. Generally, healthcare is still delivered in silos, and so just because they have your records in the hospital doesn't mean those records get to your primary care physician or vice versa. And so at each of those different care settings, generally they do work to do medication adherence, but you'd be surprised. So often it's just dump out a bag of pills and start counting, and and also very high reliance on patients' own self-reported remembrances of what they're supposed to be doing. And of course, that can also have errors involved.
You know, I was talking with someone recently, and I discovered that healthcare facilities, providers, the way that they perform a certain operation or the way that they do triage in the ER, you know, is kind of their brand. Is that sort of playing a part in this breakdown of data sharing? Is it something that is just being overlooked, or is there a deliberate reason why there exists this opportunity to standardize data sharing?
Well, I think that there's a lot of talk about changes in reimbursement in healthcare. And under a fee-for-service environment, which is where we've been for the last 20 years, each different provider is basically paid to do just their own thing. And when the patient is then passed along to the next care setting, it's the responsibility of the next guy. And what you're seeing now is more of a pay for value, which I think is really helping to align networks of providers to work more cooperatively, thinking across the whole continuum of care. And it's not until some of these new incentives are emerging that there's really good alignment in terms of data sharing. So I think we're seeing more progress now than before.
Okay, so basically what you're saying is if everyone, as far as the pharmacies, the hospitals, the clinics, I guess even the home health care providers would get on the same page as far as this particular patient or that particular patient, their needs, their meds, their schedule, then this adherence would be much easier to, I guess, adhere to, yeah?
Totally. Right. So many of these providers, they know what they prescribe, but they lack visibility in what other providers that are also involved with that patient are doing. And so this is where so many of the collisions happen. And also, you know, that patient may be getting different kinds of directions or input from different parts of that care team that aren't talking to one another.
Well, how is Loopback Analytics taking steps to fill this gap if they haven't already?
Yeah, it's certainly a work in process, so there's going to be a long road to really get it to where it needs to be. Mm-hmm. But one of the things that Loopback Analytics does is that we connect providers across a care continuum. So as I mentioned before, so if the hospital, the physicians, the skilled nursing facilities, home health, these represent different care settings, perhaps owned by different financial organizations. Loopback can connect these different care settings together so that we're tracking a patient as they move from one care setting to the next and enable better care coordination.
Now, is this a closed network, or is this accessed through the internet anywhere that you around the world if you have access to the internet?
It's a hosted solution so that if you have the right credentials, you can get access to it if you have an internet connection. We integrate with a lot of different electronic health record systems and others. We are doing some really fascinating new emergent work where people are starting to recognize that patients at high risk sometimes do cross paths between mental health authority, community-based organizations, the classic healthcare system, and even locations like jail and criminal justice. So the challenge with these isn't just technical. A lot of these are fairly complex data sharing agreements that have to be worked out. And of course, incentive alignment is important as well, that each of these different folks that are part of this care continuum need to see that their interests are protected.
Are the interests of the caregiver that is at home, the family member, the spouse, the adult child of the patient, is there support for them, efforts to bring them on board as far as this platform is concerned, or is this something that is just for credentialed facilities, pharmacies, clinics, hospitals, and then it's up to the caregiver at home to get information from the last source?
I think our company's focus has been primarily on networking providers together, but I think our customers, basically these provider groups, very much appreciate the incredibly important role that caregivers play, particularly with patients that have dementia and other challenges, that the involvement of the caregivers in medication adherence is just essential.
Do you? I know that you said one of the criteria is age-related. We've been talking about dementia. We touched on it a couple of times. Is this something that you see rolling out in elder care facilities first in order to see how things work and how work some of the bugs out, as it were? Or do you see a launch across the board wherever the need is found?
Well, I think that, patients that are most vulnerable tend to be the ones that are landing back in the emergency department, becoming rehospitalized, high rate of readmissions. And when they get very sick, then frequently they are involved with skilled nursing facilities and assisted living facilities. So a big part of our focus is wiring up the network between these acute and post-acute care facilities that care for these very sick and fragile patients. And at each one of these touch points, of course, a major focus is on medication adherence. Mm-hmm. One thing I didn't mention is that there's a terrific opportunity to leverage data in order to create predictive algorithms where computers are assisting in proactively identifying patients that are at high risk of medication adherence failure. And that really helps these providers that are caring for these patients to basically direct scarce resources and provide appropriate interventions to head off problems before they occur.
Now, where can our listeners get more information about Loopback Analytics and the steps that they're taking to address medication adherence?
So listeners can go to our website. It's loopbackanalytics.com. And certainly medication adherence is a major focus of what we're doing now, but also into the future.
Neal Smiley, it's great talking with you again today.
All right. Thank you, Neal.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, on this Health Suppliers segment, in studio with Neal Smiley, CEO of Loopback Analytics, a care transitions management platform, and we've been talking about inconsistencies in the sharing of medical data that leads to lack of medication adherence among patients. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can listen in on SoundCloud and download, and you can subscribe to this podcast on iTunes.